In October of 2016, Juliet De La Rosa was clicking along in Air Force basic training. Her dad is an Army major. Her grandfather was in the military, as well as her great-grandfather. She was called in for medical evaluation, including behavioral health, as part of her screening to be in air traffic control. A few weeks later, Juliet was involuntarily discharged from the Air Force and accused of fraudulent enlistment. Her parents and she were puzzled. They requested copies of her medical records, found notations about this mental health history that they had no idea was in those records. Come to find out, in those medical records were notations about her treatment as a child for some behavioral health issues. They decided that they should check the sister's medical records before Samantha enlisted in the Army. They found similar notations in Samantha's records. Samantha tried to enlist and she fully disclosed those notations, but the Army denied her enlistment and they denied her request for a waiver. This story has some implications for military families. Parents, at the encouragement of all the services and DoD, have been taking their children in for behavioral health counseling. Nobody says that that should stop, but what the De La Rosas are concerned about is that other military parents may not understand that their dependent medical records as a child are merged with their active duty service records, service medical records. They also contend that civilians are treated differently. If a civilian child decides to join the military doesn't have access to those prior medical records. For their part, the Air Force says they wholeheartedly encourage people to get help when they need it. But they require recruits to be truthful when they enter the military. Nobody is contending that anybody who's unhealthy should be allowed into the military. But the De La Rosas, they would like military parents to understand what could be in their records. They would like military folks, when considering whether to allow a child to enter the military who has been a dependent, to review those records with an eye toward that unique situation. And they would like medical providers to understand what impact their notations could have when a child is trying to later join the military. So here's where things stand now. Both Juliet and Samantha have been given clean bills of health by multiple DoD and civilian mental health providers, and they are with their parents stationed in South Korea. They both would very much like to join the military, but right now that is unclear as to what's going to happen to their futures.